Can shampoo really prevent hair loss? You've probably seen bottles claiming to block DHT, stop shedding, or even regrow hair. But how much of this is true? And how much is just marketing hype? Today, I'll walk you through the science, including real clinical studies, on what hair loss shampoos can and cannot do. I'm Dr. Eric Ko, a hair transplant surgeon here in Korea. Many of my patients come in with a bag full of shampoos, hoping they'll solve their hair loss. The truth is, some shampoos actually have evidence behind them, especially those with ketoconazole. But it's important to understand what they can realistically achieve. Most products promise three things. 1. Block DHT, the hormone that causes genetic hair loss. 2. Thicken and strengthen your hair. 3. Create a healthier scalp environment. But remember, shampoo is on your scalp for only 2 to 3 minutes before you rinse it off. So the real question is, in that short time, can it actually work? One ingredient that really stands out in hair loss shampoos is ketoconazole. Now, ketoconazole was originally developed as an antifungal treatment. You'll often see it prescribed for dandruff or seborrheic dermatitis. But research over the last decade has shown it can actually play a role in hair loss management. How? Through three main mechanisms. 1. Antifungal and anti-inflammatory effects. Many people with hair loss also have scalp inflammation or dandruff. Chronic inflammation around the follicle can make shedding worse. By calming this down, ketoconazole creates a healthier environment for follicles to grow. 2. Weak anti-androgenic activity. This is the big one. Ketoconazole appears to locally reduce the effect of DHT, the hormone that drives androgenetic alopecia. It's not nearly as powerful as finasteride or dutasteride, but it may give a small protective effect when used regularly. 3. Improve follicle health and density. In clinical trials, patients using ketoconazole shampoo saw thicker hair shafts and better density compared to placebo. And let me highlight the evidence. A 2019 randomized clinical trial tested 2% ketoconazole shampoo in patients with androgenetic alopecia. The results? Significant improvement in hair density and reduced shedding compared to the control group. A systematic review in Biomed Dermatology came to a similar conclusion. Ketoconazole shampoo isn't just cosmetic, it can genuinely support hair growth. In fact, in some studies, the effect was comparable to 2% minoxidil, especially for reducing shedding and inflammation. Now, to be clear, this doesn't mean ketoconazole is a miracle cure. But among all the so-called hair loss shampoos, this is the one ingredient with real clinical science behind it. If you're going to choose a shampoo for hair loss prevention, ketoconazole is the gold standard. Besides ketoconazole, there are other ingredients worth mentioning. 1. Caffeine. Lab studies show it can stimulate hair follicles when applied topically. The effect is very mild, but real. 2. Saw Palmetto. This herbal extract may block DHT, but evidence in shampoos is limited. 3. Biotin and Niacin. These don't prevent baldness, but they can improve hair shaft quality and scalp circulation, making your hair look stronger and healthier. Now, let's be clear, no shampoo, not even ketoconazole, can replace proven medications like finasteride or dutasteride, regrow hair on a completely bald scalp, or cure male pattern baldness. If you see a bottle promising to reverse baldness in 30 days, that's not medicine, that's marketing. I still recommend ketoconazole shampoo, but as supportive therapy. Here's why. They reduce dandruff and scalp inflammation. They can slightly slow shedding, especially in early stages. They support medical treatments and transplants by keeping the scalp healthy. Think of them like toothpaste. Toothpaste doesn't cure cavities, but you'd never skip brushing. Similarly, shampoo won't cure baldness, but it helps maintain the right environment for your hair. One of my patients was using 6 different shampoos, switching daily, and was frustrated when nothing changed. Once I explained that shampoos are supportive, not curative, he started proper medication, and suddenly the shedding slowed and his scalp improved. The shampoo became part of the bigger picture, not the main event. So, the bottom line. Among shampoos, ketoconazole 2% has the best clinical evidence. Caffeine, saw, Palmetto, and Biotin can provide mild supportive benefits. But shampoos alone won't stop or reverse genetic hair loss. They're valuable as part of a routine, not as a standalone cure. If you're noticing ongoing shedding or thinning, it's time to think beyond shampoo. Whether that's medications, PRP, or even hair transplant. On this channel, I share evidence-based insights to help you make the best decisions for your hair. Subscribe if you'd like to learn more.